Hello, my name is Brooklyn, and this is group 4, and this is our presentation in relation to our PICO question.
Hello, I'm Lauren Johnson.
Hi, I'm Gracie Paget.
And I'm Josie Bemis.
So, we chose to focus our research question on infant nutrition, with our PICO question being in very preterm neonates born between 28 weeks and 31 weeks and 6 days. How does breastfeeding compared to bottle or formula feeding affect body mass index within 6 months? With this question, we sought to explore the most evidence-based recommendations regarding nutrition in very preterm infants in relation to physical growth and development, and what role the nurse may play in the implementation of the replicable results of the study.
So regarding the conceptual framework, we use the Iowa model to identify possible gaps in evidence-based practice in healthcare. So in our case, breastfeeding versus bottle feeding with formula. We formulated some clinical questions that helped us then develop our PICO question. With this PICO question, we found 2 studies that related to our topic. We then critiqued and analyzed these studies for evidence that were significant to our topic. In our case, the evidence was not significant. Brooklyn and Gracie will discuss these topics further in the methods section of this presentation. But because of this evidence that we found while analyzing our studies, we came to the conclusion that we shall not implement these findings into hospital settings yet. But further research should be done on the effects of breastfeeding and formula feeding infants to then be implemented into hospital settings.
So we conducted a streamlined search using CINAHL, Medline, PubMed, Cochrane, UNF OneSearch, and ProQuest. We used key terms related to our PICO question in order to narrow our search. For example, for population, we used very preterm infants. For our intervention, we used breast milk and breastfeeding. For our compared variable, we used bottle feeding and formula feeding. And for outcome, we used growth, BMI, and physical growth and development. At first, we found 165 records that could possibly apply to our PICO question. After reviewing those and implementing exclusion and inclusion criteria and removing duplicates, we found 2 records. So for exclusion, we wanted to make sure that we excluded babies born into mothers with mental health disorders, diabetes or gestational diabetes, substance abuse disorders. We also wanted to exclude preterm infants with comorbidities. We wanted to make sure that we included preterm infants born between 28 weeks and 31 weeks and 6 days, and mothers who exclusively breastfed. So in the first study we found, it was a level 3 retrospective cohort study. It examined the effects with the addition of breast milk on preterm infants' BMI. It had a follow-up period of 2 years and 8 years. On that follow-up period, the children's BMI was sufficient. Yet, since the follow-up period wasn't close to the preterm term, it didn't show significance to our PICO question specifically.
The second study we found was a level 6 qualitative study that analyzed a set of interviews provided by mothers of very preterm neonates in a kangaroo mother care unit, or a KMC unit, in South Africa. The study assessed the general attitudes and feelings towards breastfeeding in those 38 mothers of very low birth weight infants staying within the KMC unit. The study found that generally, mothers were more knowledgeable about the benefits of breastfeeding and concluded that most believed that breast milk did have advantages over formula milk following provided patient education. So the research here concluded that overall, breastfeeding education provided by the unit nurses had a positive impact on the mother's intentions to breastfeed at home. So the interventions implicated within the KMC unit were found to be effective in increasing mothers' initiation and maintenance of breastfeeding very preterm infants following discharge.
Okay, so findings and implications for breastfeeding. When we were researching and analyzing the results of our studies, it was very evident that breastfeeding is superior to formula feeding. So in our study, we focused on the effects of breast milk on physical growth and development, and we measured this through BMI. But as Gracie mentioned earlier, whenever we were measuring it through BMI, we didn't find significant differences. So I'm going to go ahead and touch on some other things that are very beneficial of breast milk. The big one that I really want to focus on is the immunologic properties of breast milk. So when the mother is feeding their infant their breast milk, they are giving their infant antimicrobial properties as well as immunologic properties. So they're giving them antibodies, and they are quite literally jump-starting their infant's immune system. Whenever we compare that to infants who receive formula, they're not receiving these immunologic properties, so they have to be exposed to certain things before they can actually build their immune system. So obviously they're going to be at higher risk for infection and disease processes. Overall, I'm going to, or in the assignment 4 of our project, we had to identify a clinical guideline that aligned with our PICO question. We did find one, and the clinical guideline really emphasized that they believe that infants should exclusively receive breast milk for at least the first 6 months of their life. Based on this, I'm going to explain some barriers and facilitators that actually talk about like whether that's actually capable, people are capable of doing that or not. So whenever I mention these 3, they can be barriers or facilitators. The first one's going to be social and cultural factors. Culture is a big thing, and generational practices are a big thing, and that kind of aligns with culture. If you come from a family who has always breastfed and they really encourage it, they think it's best for bonding, then you're most likely going to want to do that. Whereas if you come from generational practices that maybe you're more modest and they don't think there should be that physical connection between mom and baby, then you're most likely not going to. Healthcare workers' impact on knowledge is another big one. As nurses, we need to understand the impact of our knowledge on our patients and what they're going to do with the information we give them. So if we're very knowledgeable on the impact of breastfeeding, and say we explain to them the immunologic properties or other benefits of breastfeeding, they might be more willing to push through the hardship of trying to learn to breastfeed and actually do it for their infant. Whereas if we don't give them that additional knowledge, they might not want to, and they might just say, no, I just want to do formula. Anatomy of mother and the baby is a really big one. If the mother has an inverted nipple, you're not going to be able to latch nearly as easy. If the baby has cleft lip or tongue tie, it makes breastfeeding really difficult. Whereas if you have anatomy that's perfect for breastfeeding, then it's going to be much easier, less stressful experience, and most likely the mom will be more willing. Limitations to research and evidence. So pregnant women and infants are 2 very vulnerable groups. I think that everybody kind of knows this, but because of it, it makes it really hard to do real hard experiments. We don't really want to mess with the growth of the infants or the development of the infant when in utero. Also longitudinal studies, like Gracie mentioned, her study was based on 2 years and 8 years measurements. That's a really long study. And during those times, during those 8 years, we're going to have most likely participants who drop out for various reasons. And that makes it kind of hard to stick through longitudinal studies. Another one is exogenous factors, which is like genetics and environment. These play an additional role in the ability of researching this, just because of these are things we can't control. So they're just more variables that affect the results that we have at hand.
So after conducting a streamlined search, we were able to identify relative literature that explored the effect of breast milk on physical growth and development, and also eliminate studies from our search that did not directly align with our PICO question. It can be concluded that while supplemental formula can be beneficial for very preterm infants, mother's own milk has a largely positive influence not only on infants' physical growth and development, but it also provides additional imperative immunologic and psychosocial benefits. With this evidence, our primary role as the nurse is effective patient education. Ensuring that mothers are fully informed about the benefits of breast milk and the implications for breastfeeding can aid moms in determining a plan that best fits the nutritional needs of the infant at home.